Thank you for listening to this presentation about the Nebraska Medicaid Substance Use Disorder State Plan Amendment regarding reimbursement for the medically monitored inpatient withdrawal management program. By the end of this presentation, you should be able to define the requirements, guidelines, and service expectations of medically monitored inpatient withdrawal management programs in Nebraska, identify the list of billing codes available for reimbursement, and identify the requirements for provider enrollment and MCO credentialing, and know where to find additional information on those resources. To achieve these objectives, we will discuss the following topics in this presentation: definition of medically monitored inpatient withdrawal management programs, the setting of care and facility license, the staffing requirements, the admission criteria, the length of service, the continued stay guidelines, service expectations and required assessments, Medicaid billing and reimbursement, and provider enrollment and MCO credentialing. Nebraska's State Plan Amendment was approved by CMS on November 3, 2020, which means that services for opioid treatment programs and medically monitored inpatient withdrawal management will be included as a billable service in the Nebraska Medicaid benefits set. A separate presentation is available to cover the details of opioid treatment programs. Fee schedules for mental health and substance use, A1 and A2, effective September 1st and July 1st, 2020 respectively, are available online on the DHHS website. Eligible providers can bill retrospective to date of service on or after January 1st of 2020, and you can access the full service definition from the DHHS website as well. The basic definition relative to level 3.7 withdrawal management is the reduction of the physiological and psychological features of withdrawal through short-term medical and observational services for the purposes of stabilizing intoxicated individuals, managing their withdrawal, and facilitating effective linkages to and engagement in other appropriate inpatient and outpatient services. Medically monitored inpatient withdrawal management is non-hospital intervention delivered by medical, nursing, mental health, and substance use professionals, which provide 24-hour medically monitored evaluation under physician-approved policies and procedures or clinical protocols. This level of care is appropriate for individuals with biomedical, emotional, behavioral, and or cognitive conditions that require highly structured services, including direct evaluation, observation, and medically monitored addiction treatment. This service is suitable for individuals whose withdrawal signs and symptoms are sufficiently severe to require 24-hour care, but do not require the full resources of an acute care general hospital or a medically managed intensive inpatient program. The desired outcome for an individual receiving treatment at a medically monitored inpatient withdrawal management program is that their severe withdrawal symptoms are mitigated through the completion of withdrawal and detoxification. Additionally, the individual is referred to additional substance use disorder services to facilitate continued treatment efforts after the withdrawal period. The medically monitored inpatient withdrawal management setting is defined as a licensed residential facility in accordance with the ASAM criteria described under Level 3.7 that is an actively enrolled provider with Nebraska Medicaid. Each facility must be licensed as required by the DHHS Division of Public Health and accredited by a national accrediting agency. In this training, we will sometimes use the term 3.7 WM to refer to medically monitored inpatient withdrawal programs. There are several staffing requirements that must be met within a 3.7 WM program. Programs should have licensed medical professionals available to provide a planned regimen of 24-hour, professionally directed evaluation, care, and treatment services for individuals and families. Licensed medical professionals consist of physicians, PAs, and APRNs. Programs should have appropriately trained clinicians to assess and treat individuals and obtain and interpret information regarding individuals' needs. Appropriately trained clinicians include RNs, licensed or provisionally licensed psychologists, mental health practitioners, drug and alcohol counselors, or licensed independent mental health practitioners. Programs should also have LPNs, direct care staff, or peer support services available. This slide outlines the admission criteria for 3.7 WM programs. To be admitted, an individual must meet the diagnostic criteria for moderate or severe substance use or addictive disorder defined by the most recent version of the DSM and meet the ASAM dimensional criteria for level 3.7 WM by risk assessment for each substance. The table on this slide displays the 6 ASAM dimensional criteria for service planning and treatment at the 3.7 WM level of care. Dimension 1 explores the acute intoxication and/or withdrawal potential of an individual. This means evaluating a patient's past and current life experiences of substance use and withdrawal. An example finding for a patient meeting the 3.7 WM criteria level in this dimension is that a patient has a high withdrawal risk, but also a manageable withdrawal risk not requiring full hospital services. Providers should continue to review the most current ASAM dimensional criteria for admission to the 3.7 WM level of care. Once an individual is admitted, you can use the following criteria to determine their length of stay in a level 3.7 WM program. Either the individual's withdrawal signs and symptoms are sufficiently resolved that they can be safely managed at a less intensive level of care, or the individual's signs or symptoms of withdrawal have failed to respond to treatment and have intensified, such that a transfer to a more intensive level of care is indicated. The individual continues in its level 3.7 WM program until withdrawal signs and symptoms are sufficiently resolved and they can be safely managed at a less intensive level of care. Alternatively, the individual's signs and symptoms of withdrawal have failed to respond to treatment and have intensified, as confirmed by higher scores on standardized scoring assessments, such that a transfer to a more intensive level of care for withdrawal management service is indicated.
In order to initiate treatment at a level 3.7 WM, there are several service expectations related to assessments, treatment, and other services that must be met. First, we will review the expectations related to assessments. Upon admission to a level 3.7 WM program, an individual must receive a substance use assessment, admission history, and physical examination. An individual must have a substance use assessment completed by a licensed prescribing practitioner, meaning a physician, PA, or a PRN, and/or a licensed therapist operating in their scope of practice. The substance use assessment should include a risk to self and/or others and determine the appropriate level of care. If a licensed practitioner identifies a co-occurring mental health disorder and is unable to assess or treat the individual, then a referral should be made to a licensed mental health practitioner that can meet the individual's needs per their scope of practice. The physical exam must be completed within 24 hours of admission to the program by a physician, PA, or a PRN, and must include a medical history and toxicology screen. Providers are required to meet clinical best practices for medication utilization and toxicology screening. The physician, PA, or APRN must be available to provide on-site care and further evaluation on a daily basis and be available 24 hours a day by telephone to provide access to the patient. A mental status examination by a licensed medical professional, meaning a physician, PA, or APRN, and/or a licensed therapist operating within their scope of practice must be completed as part of the intake and assessment process.
After receiving a substance use assessment, individuals with a known or suspected co-occurring mental health disorder must also receive an initial diagnostic interview performed by a licensed practitioner who is able to diagnose and treat major mental illness within their scope of practice. Such providers include physicians, physician's assistants, APRNs or nurse practitioners, licensed psychologists, or licensed independent mental health practitioners. Lastly, a registered nurse conducts an alcohol or other drug-focused nursing assessment at the time of admission, administers medications, and is responsible for monitoring the individual's progress. The next element of Level 3.7 WM service expectations relate to key services and treatment plans. Treatment plans must address the medically necessary services, which include therapy and withdrawal support services required by the individual. Plans must also include measurable goals and interventions to address the identified needs of the individual's discharge and relapse prevention planning and referrals. Discharge plans must include care coordination strategies for formal or informal supports. Treatment plans must be reassessed daily based on the individual's progress through withdrawal management. 3.7 WM programs should offer individual, group, and family counseling services conducted by a licensed practitioner practicing within their scope of practice. Counseling should address cognitive, behavioral, mental health, and substance use treatment needs. In addition to treatment plans and counseling, Level 3.7 WM programs must operate 24 hours a day, 7 days a week. Programs should conduct random urine drug testing, provide health education and addiction education services, and perform laboratory and toxicology tests as ordered by the physician, PA, or APRN. Programs must refer patients to ancillary services as needed if the service is not provided at the 3.7 WM facilities such as dental, optometry, ophthalmology, and other mental health or social services. Lastly, programs also must have an RN or LPN who is responsible for monitoring patient progress and medication administration on an hourly basis. Now let's review the Medicaid billing and reimbursement details for medically monitored inpatient withdrawal management programs. The table on this slide displays the procedure codes and rates for 3.7 WM services. The procedure code for MIWD services is H0010. The second column displays the short service description for the corresponding H code. The third and fourth columns include the associated rate figure and unit type. The fifth and sixth columns display the provider type, 52, and provider specialty, 26, for MIWD services. Most services will be reimbursed by the individual's managed care organization. Fee schedules, as noted previously, are available online and are already effective. Eligible providers can bill retrospective services from January 1st, 2020 and after, and the individual's primary diagnosis code must be substance use disorder. To enroll as a provider, a level 3.7 WM program must meet the following accreditation requirements. The facility must have a mental health and substance use treatment center license as required by the DHHS Division of Public Health. Additionally, services must be provided in accordance with the ASAM criteria described under Level 3.7. Instructions on specific provider screening and enrollment requirements can be found online on the Maximus website. Medically monitored inpatient withdrawal management programs must have the appropriate facility enrollment with the Nebraska Medicaid program and appropriate licensure. Facility credentialing and contracting would follow the MCO standard facility credentialing and contracting process. For additional information on MCO credentialing and contracting, providers may review the following websites on this slide. For more information about OTPs in Nebraska, please submit your questions to dhhs.medicaidsud@nebraska.gov or visit our website. Please note, the following ASAM and SAMHSA resources were used to create the service definition criteria. The ASAM criteria were utilized throughout this training in support of DHHS's goal of implementing evidence-based care, not for marketing or promotional purposes. Providers have an obligation to obtain a permission agreement directly with ASAM if the provider wishes to advertise or market their use of ASAM criteria.